Hey Shark fans, it's Melinda Marsalis. Welcome to Heard It on the Shark. Heard It on the Shark is a weekly interview show that airs every Tuesday at 11 a.m. on the Shark 102.3 FM radio station based in Ripley, Mississippi. Then it's released as a podcast on all the major podcast platforms. You'll hear interviews with the movers and shakers in North Mississippi who are making things happen. I'll talk to entrepreneurs, leaders of business, medicine, education, and the people behind all the amazing things happening in North Mississippi. When people ask you, how did you know about that? You'll say, I heard it on the Shark. Musical credit belongs to Hill Country Blues guitar legend Gary Burnside and the late great Buddy Grisham, playing Long Way Home from their album Acoustic Brothers, which was recorded at Sun Bear Studio in Ripley, Mississippi.
This program was recorded at Sun Bear Studio in Ripley, Mississippi.
Hey Shark fans, it's Melinda with another episode of Heard It on the Shark. And today in Sun Bear Studio, I have with me Miss Marcia Garrett, who is a family nurse practitioner who works for North Mississippi Primary Health Care, and she is their HIV coordinator. Marcia, thanks so much for coming on the show.
Thanks for inviting me, Melinda. It's great to be here.
You are part of our May tribute to nurses because it's Nurse Appreciation Month, and we are interviewing a different nurse every week in the month of May. So thanks for coming on to help put a show of support out for your nurses.
Nurses are the backbone of health care. If you don't have us, it's going to fall apart.
Yeah, I got to agree with you on that. I love my local nurse practitioner that I go to, and it is so awesome. It's like she kind of knows you front to back, little stuff, big stuff, and that's so helpful in your overall health.
It is, and nurses, one of the biggest things we're taught is to educate and to listen. And I had a nursing instructor once who told me the average person operates on a 4th to 5th grade level when it comes to health and medicine. And I will tell you, my husband is one of the smartest, most well-educated people I know. When it comes to health and medicine, that man is clueless. So, yes, just because you don't understand it doesn't make you stupid.
I know it makes you nervous to go in there. You forget what you came to ask. And it is intimidating when you go into any kind of medical place. But going to your nurse practitioner who knows all about you is a really nice thing.
A lot of times it feels more like you're going in to talk to a family friend about what's going on and how they can help.
That's right. Absolutely. Okay, so let's talk about being the HIV coordinator. Are you from Ripley where we're recording today?
No, I actually live in Oxford. I've lived there for 25 years. And prior to that, I lived in Baldwin.
Okay, you're from North Mississippi.
I am.
Okay, and you live in the big town of Oxford. You're fancy.
Yes, I am so fancy.
That's right. Okay, so Marcia, you've been with North Mississippi Primary Health Care for how long?
For almost a year.
And did they hire you to be the HIV coordinator? Is that your full-time job with them?
It is. They had a grant to do HIV screenings and treatment and needed someone to do that. I had experience and said, hey, I can do this.
Now, is it really that prevalent?
It's a lot more prevalent than people would think. If you actually look at the statistics, Mississippi has the largest number of new HIV cases in the country. If you break it down by city, Memphis and Jackson are right there at the top. And Memphis isn't in Mississippi, it's right next door, and we have a lot of people going back and forth.
Okay, so there is not an epidemic, I guess, but there's a lot of education that needs to happen.
There is, because people don't know. When I grew up, it was, that's only for people who do certain things. And that's not the case anymore. Anybody can be positive, and it is running rampant.
Okay, so what should people do first? Let's say that they think they might be HIV positive. Is it anything else? Is it just HIV?
No, well, we do free HIV and syphilis screenings. We also offer screenings for gonorrhea, chlamydia, and trichomonas. Those aren't free. They are very low cost and affordable. And then we also offer lab work to check for herpes and hepatitis C.
And you can do all this at any one of the clinics?
At any of the clinics.
Okay, and they're scattered all over North Mississippi, so there's a lot of them. So for you people that are listening, if you've not ever looked at it, North Mississippi Primary Health Care has clinics all over Northeast Mississippi. So look them up, find one close to you. So they call up and they say that they want to be tested, do they have to come to one particular place?
No, they can go to any of our 10 locations and go in. If they're an existing patient, just see their provider and tell them what they need. If they're a new patient, they'll have to fill out paperwork and register as a patient. But any of the clinics can do it.
Okay, and the HIV testing and the syphilis testing are free, but the others are not free, but inexpensive.
Right.
Okay, let's say that there's a person out there, they don't think they're HIV positive, but they want to know more about it, like how it's spread and who can get it. Do you have information like that for them? We
do. We also have it listed on our website where it shows HIV and it'll tell you what the common symptoms are. It will tell you about how long it is from the time of exposure to when you may start seeing symptoms. And I recommend anybody that's concerned that you may have been exposed, come in and get screened.
Okay, right. Yes, and if you go to the website first and you start learning about how it might manifest and how long it might take to manifest, then you can do some of that before you ever go talking about it in public.
Right. And some people already know because they've heard about it, they've read about it, they've researched it. They have a family member or a friend who is HIV positive.
And so, all right, let's just say that you find out that you are positive for any one of those diseases. You are infected in some kind of way. Do you guys do the treatment as well?
Yes, we do. We do antiretroviral therapy or ART for people who are HIV positive. For those who are not positive, but maybe they're concerned that they're going to be exposed, we do what's called PrEP. It's pre-exposure prophylaxis. There is an oral version and an injectable version, and we do both.
And that, of course, is not free.
No, that is not. We can help them get it if they don't have insurance. There are lots of ways to obtain the medication if they need it.
Okay, this is great. And I know that these are topics that people are very sensitive about. It feels embarrassing to talk about it. And you may put off doing what you need to do because you're embarrassed. What do you say to that?
I say, I know it's a sensitive topic. It's hard to talk about. I've gotten used to talking about it over the years, so it doesn't bother me. And just remember certain things. Number one, what you say to your provider stays in that room. We cannot, by law, mention what goes on in that room and in the clinic. So all of that stays with us. And I tell patients that this room, these four walls, are a safe zone. You can come in here and tell me anything, and I can't repeat it.
Well, let me ask you this, since we're talking about privacy. And I mean, you know, if you're from Baldwin, I'm from Ripley, these are small towns, and the nurse that your receptionist or whoever checks you in, you might know and you might be too embarrassed. Would it be inappropriate to go to another town that's not your hometown?
Oh, absolutely. I know patients and I have friends that have had sensitive issues and they've chosen not to go where they live. They've gone a town over because they're like, I just don't want to go in and have everybody talking about what's going on.
Okay, so you could even say more anonymous by going to a town that you don't live in.
Right. Let's say you live in Ripley and you know everybody in Ripley, but maybe you think, not really where I want to go. You could go to Walnut. You could go to Corinth. You could go to Ashland. If you really wanted to, you could come over to Oxford to that clinic and then go eat at one of our fabulous restaurants.
In your fancy restaurant.
In one of our fancy restaurants.
Okay. Before I let you go, Marcy, tell me about your education background. Where did you go to school?
I got my nursing degree, my RN, from Northwest Community College in Senatobia. I worked at Baptist Memorial Hospital in Oxford for several years as a baby mama nurse. Shout out to all the labor and delivery nurses out there. And loved it. Went back to school to get my master's in science and nursing. I went to Vanderbilt for that. And then I worked as a family nurse practitioner for 10 years, just doing family practice, which did include HIV, before coming to North Mississippi Primary Health Care as the HIV program coordinator. I am also a certified PrEP navigator and a certified HIV prevention primary care provider.
So you're just an expert, aren't you?
Well, I don't know about expert. My daddy always says X is a has-been and a spurt's a big drip.
Okay. Okay. Could you write that down before we leave? I'm going to use that.
So that's just what he always says. I certainly have a lot of information, and I'm constantly reading and researching and reaching out to people who know more than I do to find out, hey, what's the best way to treat this? What's the best way to handle this? And Melinda, something else I'd like to let your listeners know about is understand that you may be sensitive about thinking you have an infection. Understand that if you leave these things untreated, it can affect your ability to have children down the road. It can cause issues with infertility. It can cause pelvic diseases. It can cause diseases in the prostate. And I don't think anybody wants any of those.
No, better just to rip that Band-Aid off and go on and take care of yourself.
And studies have shown that 80% of our patients want to talk to their provider about having a healthy sexual life or having safer sex. They just don't know how to initiate the conversation.
Absolutely. And so it's good to know that you're anonymous while you're in there. I love all of that. Well, Marcy, thank you so much for what you do. Thank you for letting your path bring you and keep you in Northeast Mississippi. And Shark fans, you guys get out there, spread the word about this to anybody that you feel like needs to hear it. Thank you, Marcy.
Thank you, Melinda.
Shark fans, that's it for this edition of Heard It on the Shark. You can tune in every Tuesday at 11 a.m. to find out what's going on from other local community leaders like Marcy. If you have a question, comment, or suggestion for an interview or for access to this interview, go over to our website, shark1023.com, and click on the podcast tab. Keep it tuned to the Shark 1023 and have a great rest of the day. This show is made possible by JC Media, LLC in Ripley, Mississippi. JC Media owns the Shark 102.3 Classic Rock FM radio station where the show is hosted. Subscribe to our podcast on your favorite app or stream episodes online at shark1023.com/podcasts. We also have an email in which you can share your feedback. That email is theshark1023@gmail.com.